This is what we do. This is what we have been doing from the very beginning. And that's the work of public health. We do this for all of our reportable communicable diseases. And from the very beginning, we have been taking histories from cases for that 48 hours or longer before their symptoms started. And it's to find out where they've been, what they've been doing, but also people that may have been in close contact. So it speaks to the asymptomatic spread as well. What we do know is that most of this is spread between people who spend time together, so indoors. So having a meal with somebody, being in a meeting room with people for longer periods of time, when we have even mild symptoms, and sometimes, you know, the jury's out about how much asymptomatic spread there is, but we do know that when you have those close contacts, when somebody is talking, when you're in a close environment together within a meter, those are the situations that we know this is transmitted. So we know it's transmitted mostly to the people that we are closest with, and that we bring it home to our families, and particularly our elders and others in our families. We bring it into our workplace, and we sit and have lunch with people, and that's where we spread it to each other. Or we're in the break room together, or those are the types of settings where mostly it is spread. So those are the things that we try and find in public health, and that's the work that we do and have been doing. And yes, we've ramped up the people who are able to do that, and also who support us in monitoring cases, people who are infected, who are being isolated at home, as well as the close contacts, because we want them to stay away from others. If we know you've been in contact with somebody who's a case, we want you to stay away from others for the period of the incubation period, so that if you get sick, you're not passing it on to anybody else. So yes, that is the work that we've been doing. Yes, we've been ramping it up, and we expect to do it more coming into this new phase where we are much more focusing on everybody in the community now and detecting those people. In terms of an app, we have been using some apps voluntarily in some parts of the province already to help facilitate that ongoing connection with people after they've been identified. There is an initiative nationally to look at an app that people would voluntarily put on their phone. Of course, we're very sensitive to the privacy issues around that, and I'm not entirely sure yet whether we're going to be part of that here in BC. There's lots of different apps around the world. There's the one from Singapore as well. It's called Trace Together, that I know Alberta is looking at in some detail, and we are also in BC. So one of the things that I found is that there's a whole lot of people that have apps that we need to sort of sort through, and the federal government, the Public Health Agency of Canada, has done quite a bit of that work. So we are looking at what could be helpful for us, mindful of the privacy aspects that we're all concerned about.